So non-ischemic dilated cardiomyopathy currently represents one of the most important reasons for heart transplantation worldwide, and we have tried to answer the question of how to improve the prognosis of these patients by implementing stem cell therapy techniques in our center. We have started doing this in 2006, and we have built a significant registry of advanced heart failure patients with non-ischemic dilated cardiomyopathy undergoing this procedure. However, throughout these years, we have found a significant variation in clinical response to this therapy in different patient subpopulations. My name is Bojan Vrtovec. I'm the Medical Director of Advanced Heart Failure and Transplantation Center in Ljubljana, Slovenia. And in this presentation, I would like to briefly discuss the findings of our recently published paper in Mayo Clinic Proceedings entitled Larger End-Diastolic Volume Predicts Response to Cell Therapy in Patients with Non-Ischemic Dilated Cardiomyopathy. So the aim of this trial was really to better define the responders to cell therapy in non-ischemic dilated cardiomyopathy. Based on the results of Chart-1 trial, which was performed in patients with ischemic heart failure, we have found that there may be a cutoff of end-diastolic volume between 200 and 370 milliliters that can be used as a criterion for selection of patients who may have better response to cell therapy in non-ischemic dilated cardiomyopathy. So in collaboration with Mayo Clinic with Professor Terzik, we have performed a study of our registry. We have included 133 patients with non-ischemic dilated cardiomyopathy and divided them into two groups based on their end-diastolic volume. So the first group was end-diastolic volume below 200 milliliters, and the second was end-diastolic volume between 200 and 370 milliliters. We have followed the patients for 1 year, with the primary endpoint being change in EF. We have seen actually that patients with larger end-diastolic volume had better response to cell therapy, meaning more increase in left ventricular ejection fraction. Actually, this was linked to better improvement in exercise capacity and also lower rates of hospitalizations, which is, of course, a very important endpoint. Why this may be the case? Potentially, we have also seen that patients with larger end-diastolic volume had higher decrease in mitral regurg as compared to patients with lower end-diastolic volume. So this one may be one of the putative mechanisms behind this finding. And the other one could be actually that patients with larger end-diastolic volumes have more areas of myocardium that can be targeted with stem cell injections, because we typically use transendocardial stem cell injections guided by electroanatomical mapping, meaning you have more areas of potential hibernating myocardium that you can improve by this kind of therapy. So what do these findings mean for everyday clinical practice? There may be a subpopulation of patients with non-ischemic dilated cardiomyopathy, as well as patients with ischemic heart failure, that may significantly benefit from cell therapy. So maybe when stratifying patients and considering patients for advanced therapies, it would be useful to consider end-diastolic volume as a marker as when to refer a patient to this kind of therapeutic approach. So maybe using this in conjunction with other therapeutic modalities, we can potentially improve the patient's outcome in non-ischemic dilated cardiomyopathy and decrease their hospitalization rates. I hope you found this presentation clinically useful. Thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.